My book?
Me standing this way.
Yes, sir, you can do it. You can do it.
Okay. So anyway, the vitreous gel is very much like egg white. It has a liquid and a solid portion. And as we age, the invisible molecular structure, which would be like a screen window in 3 dimensions, like a matrix. You get it. We're constantly being bombarded by gamma rays, by cosmic rays, by X-rays, by microwaves, radio waves. Everything is going through our body. Okay, and as these electrons and microparticles bombard us, they pick off an electron here and an electron there, and the molecule changes. And when the molecule changes, the protein denatures. And if you want to see how protein denatures, you just fry an egg. You've got the clear egg white, you throw it on a frying pan, and the heat causes the molecular bonds to break. Well, in the eye, when the molecular bond breaks, what happens is that these invisible fibers tend to aggregate together. And when they aggregate, we call them fibrils, and it looks like a ball of dust that you find behind the dryer. And the surrounding vitreous in this area tends to liquefy somewhat. And when that happens, the liquid vitreous goes through the surface of its encapsulated membrane. We call that the hyaloid. When enough goes through that, then you have what's called a posterior vitreous separation, posterior vitreous detachment. It's not a retinal detachment. The fluid gets behind it and it peels off like water behind wallpaper. When that happens, you get a posterior vitreous detachment or separation, and you see other kinds of floaters, little different floaters. Stuff that was in the periphery flops towards the center. And most people are not disturbed by that, but for some patients, the floaters are bigger. I'd say maybe 5% of PVD patients have a problem. Most floater patients, a doctor will tell them, don't worry, you'll get used to it. If they said that to 100% of patients that came into them across the board, they'd probably be right 95% of the time. But the kind of patients I see are the other 5%. The 5% that have a problem with it, whether it's a visual problem or a work problem, or they're monocular, they have one good eye. If they have one good eye and they have an opacity, then it's very disabling for them. And I only go ahead if I think I can do it. The reason I can do it is because I'm fortunate to have a machine that was made in Switzerland for the express purpose of doing vitreous laser surgery.